Caribbean region is always a very tough region. All of you know that, and it is surrounded by sea. Therefore, the incidence of infections are going to be very high. We have an excellent presenter there, none other than the president of Trinidad and Tobago Medical Association, Dr. Darren Dookeeram. He is an emergency medicine physician by profession, and he is a member of the Royal Society of Biology and Fellow, and he is a full-time senior medical officer in emergency medicine. I am really confident through this emergency medicine physician, who is also the president of Trinidad Tobago Medical Association, we will learn about the incidents and the commitment of the health workforce in the Caribbean region, and also the risks involved and how they have managed, and what is their suggestion for the future of control of this infection, as well as safeguarding the health workforce. Over to Dr. Darren Dookeeram.
So firstly, thank you for that very kind introduction. As you would have said, my name is Dr. Dookeeram. I am an emergency medicine physician, and I'm president of the Great Trinidad and Tobago Medical Association. And I would like to highlight Dr. Maria Dillon Remy, who is one of our senators who is in our audience today. I've been asked to present on the Commonwealth health workforce pandemic and its effect on the health workforce in the Caribbean. And to do this, we have to look at some statistics. But first, we must ask ourselves, why are we here? We've been given a list of objectives that our president of CMA would like us to accomplish, but really and truly, what I would like to highlight and focus on are the strengths and weaknesses of the Caribbean response, as well as the resultant opportunities and threats that have been derived from the challenges of this pandemic. What do we think about when we hear the Caribbean? As our moderator may have implied, the picture on the screen, I think, may be the image that comes to mind. And therefore, where would one be able to contract a virus in an environment such as this, where the population would be theoretically well dispersed and there would be a good need for social distancing? However, to hone in on this, we must look at our population densities, because although we are indeed surrounded by the Caribbean Sea, as many island nation states, the population densities as demonstrated on the table are actually very similar to our colleagues within the Commonwealth, and certainly are fairly constant with the exception of some of our larger neighbors such as Guyana. Our reality is as seen on this photo, because our economies tend to be very dominated by marketplace and sales, and therefore there's a significant amount of crowding. And as we know, this fuels the pandemic spread. Our reality is that the GDP expenditure on health varies somewhere between 4 and 7%. Of course, we may lag behind some of the more developed nations, but if we look, we will see that it's fairly well dispersed between that range. If we look at the current statistics on the healthcare workforce, and we've subdivided it by nation in terms of the number of beds, physicians, and nurses per 1,000 capital. And again, we see some variation depending on which island or which nation state we look at, but it is fairly constant for each one of these, and it actually is very comparable with some of our greater neighbors. So also looking at the IHR capacity in terms of disaster. Disasters are very prone to occur within the Caribbean, and we actually have a rating that is similar to even the United Kingdom. Look, however, at the last column where we highlight the NCD mortality, and this will factor into the threats that are posed to our Caribbean nations. And specifically, some of them are on the graph, but a little bit outside the curve, such as Guyana, where the NCD mortality is very high, as well as in Trinidad and Tobago. So this is a scourge that we have to deal with in addition to the pandemic. The current roles of the healthcare workforce. As in all systems of clinical governance, we will focus on education and training, clinical audit and quality improvement, clinical effectiveness, research and development, openness and risk management. And the Trinidad and Tobago Medical Association, as well as associations around the Caribbean, have focused on these things through education, advocacy, mentorship, and leadership. We are, however, faced with this great calamity. And focus now on that table that's presented to the right of the screen, because although our net numbers may not be as great as some of the other countries within the Commonwealth, the number of deaths is actually very comparable in terms of the percentages and actually may exceed in certain circumstances. What is the role of the healthcare workers in the management of COVID-19? The healthcare workforce has been seen as an essential service, as it always should have been, but it is important to note that all islands have variable access and very multidisciplinary services. We are a very vast set group of nations, and therefore what we may find in Trinidad and Tobago may not be present even in some of our closest neighbors, such as in Grenada. Most countries have established the alternate pathways in the existing facilities when possible, and this has included primary care, secondary and tertiary, and even in the communities. In Trinidad and Tobago, there has been an established parallel system, which was operationalized using a hospital that had not yet been fully equipped. The healthcare workforce has had to deal with additional services, such as phone hotline operators, as well as a great role in the contact tracing efforts by the ministry. And as a result of this, the recruitment process has been very intense over the last 6 months. We must ask ourselves, though, whether this is really sustainable and where these health force workers will be employed in years to come. In terms of expectations, I've divided this into 2 sections. One is what is expected of the healthcare workforce, and the second will be what is expected by the healthcare workforce. So what do organizations and society expect of us, of the healthcare workers? And in terms of the human resource, as we've said, they expect us to assume extended roles, especially in resource-limited environments where we must utilize the resources that we have. And this is not just for clinical staff, but also for administrative staff. In terms of the clinical, as always, we are expected to have evidence-based guidelines by which to manage these patients properly, as well as up-to-date skill sets. In terms of the operational needs, we must have proper risk management and research and development. And what does the society expect of us? It does require service delivery, as we've said, extended roles, but also education and advocacy, because we will be those who are most educated and in a position to support the views of the ministry's administrative response. And of course, openness. Everyone in society expects us to deal with them with the due level of respect that they deserve. And what is expected by the healthcare workforce? In the same way that organizations expect of us, we expect of them. We expect of them leadership. We expect of them the need to increase the multidisciplinary workforce. We expect of them regulatory frameworks and, as has been alluded to before, innovations to prevent burnout in the healthcare workforce. We expect psychological support, as well as reducing density gaps in the health workforce itself. And most specific to this presentation, we expect our employers to supply us with the adequate levels of PPE with reference to the procedures and the interactions that we have with patients. We expect a certain level of medical education, as well as the focus on workers, especially within the community, because ultimately they take a great deal of burden of what is going on. Operationally, we expect needs projections to be done, equality and equity, and then as has been said before, compensation and a certain level of insurance, given that we are in a novel pandemic and we are not sure what the standard baseline level of care should be. And what do healthcare workers expect of the society? Yes, it's always nice to have people clap for us and people accolade us in whatever ways they have in the past. But without the society's compliance, we cannot flatten the curve. And this puts not just the society, but all healthcare workers at risk. In terms of the available resources, in the Caribbean, we actually have multiple universities that graduate healthcare workers in all aspects. But it is worthy to note that throughout the Caribbean, there are fewer subspecialists, and we often depend on the importation of such persons from especially Cuba. We have often staff realignment, but one of the biggest gaps and challenges that we face in terms of the human resource is fear. fear that we will ourselves become ill as well as our families becoming ill. One of the biggest resources that we have in terms of the clinical is the existing functioning system, because most islands will have a healthcare system that delivers care. This is challenged by the inconsistent guidelines, by the high burden of non-communicable diseases. And as we know, there are a lot of hematological illnesses within the Caribbean as well. Specifically to this pandemic, we look at testing ratios and reporting, and there's actually not a lot of documented data in terms of the ratios of testing, but it certainly is something that has been looked at. And our parent body within PAHO has actually within the last 24 hours advocated for more testing to be done. On the ground, the narrative really is that the reporting timeline is what disadvantages us, because people often wait for long periods of time to get their results. And as a result of that, they're quarantined for longer and kept within healthcare institutions for longer. Another significant challenge is that we can realign staff, but this is an intense process and we must be innovative. Often some of the staff that is incorporated may not have a healthcare background, and it is very difficult for them to deal with patients who may become aggressive with them. So it does require intense realignment of thinking. I've listed a special topic as externalities. I would say an available resource within the Caribbean is the presence of international NGOs who always assist, especially those who are more disadvantaged. But often our populations tend to lack a bit of understanding, especially when the guidelines change, for instance, with mask wearing, because initially we had said that masks were not indicated, and then we had to explain thereafter why masks were actually very helpful. And to people who are not really focused on scientific endeavor, it's difficult to understand why the experts are giving evidence that may seem contradictory. So it is, the onus is upon the healthcare workforce to emphasize best care practice. I've listed alternative views. As we know, the World Health Organization has been challenged. And really and truly, this is not helpful to the delivery of health within the entire globe. So alternative views and facts. Looking on again, in terms of the resource operationally, we do have economies of scale in some of our islands, so especially in the Eastern Caribbean bloc. There is a negotiation process that goes on in the usual setting. But of course, the supply chain across the Caribbean has become vulnerable because of this pandemic and because of the need to often freight things in for use. There has been challenge in terms of the procurement of PPE, and because a lot of this has been taken up by larger economies. In terms of data, it has been noted to be inconsistent and often inactive. Data management is something that has to be on stream or become on stream for us to be able to respond to real-time needs in the healthcare workforce. One of the most difficult challenges in the operational aspect is having the ability to manage both the alternative or parallel system with the routine systems that must deliver care to patients who have needs. However, we are asking the healthcare systems to share human resource, to share operational capacity, to share infrastructure, and to share finances, and that in itself is a colossal task. In terms of the financials, I would say that there has been good political will, but the gap will be that there were infrastructural limitations in a lot of the islands. And one of the biggest challenges that I think we face is the low investment in technology, in terms of data tracking, in terms of electronic medical records, because without these things, our response tends to be not as efficient as it should be. And then, of course, one of the challenges is that we often need to source funding from external sources. Vulnerabilities, weaknesses, and threats. And some of these will be specific to the Caribbean, others will be more diverse throughout the globe. Within the Caribbean, we actually have high migration of skilled workers, meaning that although we graduate a large percent of medical staff, they are often taken up by larger economies, which is in itself a problem to our sustainability. There's a high percentage of providers within the healthcare workforce. So if you take away the ability of those workers to provide for their family, they automatically become disadvantaged, not just in terms of themselves, but also in terms of their family. Often funding has been channeled away to fund other events. But one of the more specific things is language and cultural barriers. We've said that we have had the need to import some levels of staff. Some of them may be Spanish speaking. And that in itself is a problem if they come into a society where they do not properly understand or immerse themselves and have the ability to understand the specific needs of our population. We have recently been challenged by a large influx of Venezuelan migrants and therefore vice versa, because if we do not understand the language that they speak and their cultural nuances, we may not be able to deliver the best standard of care to these individuals who need help. In terms of finance, we've said before, often our countries come from middle and lower income market economies, and therefore the market pressures exerted by larger economies is marked. I would subdivide the Caribbean into two subsets. Some are tourist dependent, and therefore if we close our borders and we decrease the number of flights, cruises, and markets, this directly disadvantages the economic sustainability of some. The others would be hydrocarbon and manufacturing-based societies. And because of the decreased need that this pandemic has caused, the economy also suffers. And in addition to all of this, the foreign exchange limitation that we face decreases our ability to be able to purchase things like PPE in our global economy. In terms of national security, we have sometimes difficulty in securing our borders, and they're noted to be porous in some circumstances. And there are also challenges to the enforcement of regulations. In terms of foreign affairs, like we've said, pressure from bigger economies and refugees. On this slide, really, the environmental and agricultural would be the one I think is very important, because like we've said, the Caribbean sits within a hurricane belt, and this has affected many of our sister islands over the last year, for instance, and especially our colleagues in the Bahamas. And they must then reinvest a large part of their GDP into rebuilding, into reestablishing infrastructure and operations, and therefore their capacity to sustain emergency health systems may be impaired. There's also a high dependency on importation. And this is where we are actually very dependent on states to import things like food. And of course, these require high levels of recurring investment, which means that we may not have as much residual GDP to invest in health should the need arise. Specifically in this presentation, we must address what the effect of this pandemic has been on our healthcare workforce. And I don't think that some of these things are very specific to the Caribbean, but we must restate certain things. Psychologically, there has been a huge body of evidence relating to burnout and the effect on mental health. And this must be something that we focus on, not just for the individual providers, but also the associated stigma, and that stigma that they may face as potential sources of the virus when they go out into public to do basic things and establish basic needs. Of course, from the physical aspect, we are the highest risk for developing the illness, and there's no real data on how many healthcare workers have been affected. But suffice it to say that doctors and nurses in the Caribbean have been institutionalized for having contracted the virus itself, and the high demands that this places on the healthcare workforce. In terms of the socioeconomic, we must look at direct and indirect effects. And especially in the indirect, it's the opportunity cost, because we're required to work longer hours. And even when we quarantine people, we're taking them away from their family for a prolonged period of time. It cannot be underscored enough that this is having a significant impact on the delivery of medical education. And because of that, it is affecting the ability of young ones to gain specific skill sets and for established physicians to advance themselves within the fraternity. The Medical Association in Trinidad and Tobago has embarked on a significant digital campaign, which is very different to what we used to do, in an attempt to bridge this gap. I would say one of the positives is spiritual, because I think all of us have come a little bit closer to our Lord in the last few months of life. This requires significant disruptive innovations for us to be able to get a handle on this. If we look at solutions and future projections, what must we do short term and long term? In the short term, human resources and departments must be able to standardize employment. But like we've said, in building this capacity, we must protect our workers. We must say that we will ensure these workers so that years from now, people cannot come back and say you did not deliver the standard of care and therefore you are medical legally responsible. We must protect the workforce. We must remunerate the workforce for the long hours that they've done. If we are saying that people are to deliver evidence-based guidelines, we must make these guidelines readily available and push towards having everyone update themselves clinically. And this includes PPE training on a recurrent basis, because without that, we are all at risk. And as has been said before, we must improve the advocacy programs, and especially in terms of research and development to build that culture. In terms of operational, we must protect our workers, but we must develop contingencies. We must develop partnerships with private and NGOs. Financially, we must have the ability to bolster the expenditures and especially protect that GDP expenditure on health. And we must be able as nations to protect not just health, but also our economies through diversification and our environment by building sustainable efforts that take into consideration things like climate change. I would say that the strengths of the Caribbean response, whereas the borders may have posed up problems in terms of them being porous, they actually have had some positive effect in terms of limiting foreign movement, because in cutting off the airport, we would have decreased or stymied the influx of potentially positive patients. We have well been able to integrate with social services, and there has been early political buy-in with a prioritization of health needs. We were able to establish early interventions, but it must be noted that this is because the global trends were observed from early on. In terms of health, we cannot underrate the effect that PAHO has had and the good work that PAHO has given to us within the Caribbean region, especially in terms of disaster capacity. I am a proud EMT provider within the Caribbean, and this program has in itself revolutionized the way that we look at disaster building capacity. And because of that, both in the Cayman Islands and in Barbados, level 1 EMTs have actually been approved. I've been asked actually to mention that we are very familiar with operation in a resource limited environment. So having a squeeze, so to speak, is something that we are familiar with. And informal communication, because although we don't have large colleges within the Caribbean that unify different specialties, subspecialty groups do indeed communicate through their university channels with each other. What are opportunities for growth? And I think looking forward, this is where we need to go. If we are to grow our human resource, we must focus on safety, the mental health and well-being of our employees through EAP programs. We must focus on not just the employees, but also on the families holistically and being able to deliver care and well-being. And we must be able to deliver hard and soft skills in terms not just of IQ, but also EQ and AQ. Clinically, this is a fantastic opportunity that will push us in the direction of digital health in terms of social media for sensitization. But we must protect medical education. We must build a research culture. We must encourage primary care delivery at home to prevent an overburden on our hospital systems. And we must, again, have discussions on the legislation behind end-of-life care and advanced directives. In terms of operational, we must develop those contingencies as well as infrastructure. We must strengthen collaborations and integrate within the community. And of course, financially, we must develop GDP allocations that are specific to health with a specific rule of growth of this percentage. And we must develop contingencies. My final thoughts on this presentation is that we are really living in a world with a new normal, a new essential, and new heroes as it relates to healthcare workers. But this was always the case. COVID-19, though, has placed light on many what I call shadow realities. The responsibility and opportunities for health workers are indeed self-evident. And it is imperative that we are provided with the tools, opportunities, and protection to be efficient. as a member of the health workforce team, I am indeed humbled and honored to be here today to speak amongst you great luminaries and to this most esteemed panel. I thank you all for your time, and to Mr. President, thank you for allowing me this opportunity. Good evening.
Thank you very much, our President, Trinidad Tobacco Medical Association, as well as an emergency medicine physician. You have highlighted enormously on the necessity of improving the healthcare of the Caribbean region. It is same throughout all the Commonwealth developing nations. More GDP has to be there, more protection to the health workforce has to be there, more policy changes has to be there, and health workforce shortfall has to be managed. You have put things very well. We are extremely thankful to you. Definitely it will have a good contribution to the document which is going to be prepared by CMA. Now, my colleague, moderator, Dr. Oruho is here. Dr. Nosakare Uruhu.
Yes.
Yeah, he's there.
Thank you very much. I
request you to take over from